God bless you. This is Bishop Sedgwick Daniels. What an exciting day at Holy Redeemer Institutional Church in Wisconsin First Jurisdiction. A historic moment once again that we have been favored to relaunch the C.H. Mason Health Clinic. Our partners, Anthem, Blue Cross and Blue Shield, the Holy Redeemer Educational Team, and our community at large, came today to celebrate the relaunching of a clinic that we have envisioned as part of the community's empowerment plan. As many of you are aware, the health disparities and health food desert and all of the concerns that impact community are ever increasing in our area. But we have a mandate that is biblical, a mandate that is also moral, for us to address the total person. And in addressing the total person, we must address their health, their education, their spirit. In other words, body, soul, and mind. So today is a day that we celebrate and we rejoice. We are grateful for the mayor of the city of Milwaukee, the county executive, many of the doctors and many of the health professionals that came for the ribbon cutting and relaunching of a phenomenal and exceptional space called the C.H. Mason Clinic. Hundreds of our parents were in attendance, and students and community individuals as we come together to empower community. Our educational acumen of Holy Redeemer is inclusive of advancing education and allowing individuals to soar to new and higher dimensions. I want to thank God for the vision that He has entrusted us with. We do not take it lightly, but we shall ascend courageously to new horizons, and we shall ensure that our community is better because of us. Our window, our time, our space will allow others to look back on these days and say, those people had a mind to work. And when the people of God have a mind to work, we can do enormous things. So we're grateful to God, we're thankful for partners, and we're thankful for you. Continue to support the various ministries of the Holy Redeemer Institutional Church as we advance community, and may the great Consolator be your guide. And remember, there is nothing too hard for God. God bless you. To greet you this morning, I'm so grateful and I'm so thankful for your attendance here this morning as we empower community and ensure stability of our neighborhood. It is ever so important that we take responsibility for the various components that make the quality of life for us better. Those components are critical to us here on our campus at the Holy Redeemer. I'm Bishop Sedgwick Daniels, the founder and establishmentarian of this complete ministry. And we've watched over nearly 40 years the evolution of things that have aided and assisted in advancing the betterment of life for humanity. So what a joy it is to greet you. And there are two phases that we will take into consideration this morning. First is our health care, because your health is very important. And additionally, education. And in a few moments, a number of you, and I thank so many of the parents that are here with your children, that are here as well, and for educational purposes and school readiness. And of course, we start activities, the school day, the Tuesday after Labor Day. But your attendance here today in August, so that we can be ready and prepared, is exceptional. Coupled with that is to make sure that those components that affect our lives that we address, and that is the C.H. Mason Clinic. Many years ago, because of the concerns in our community and the closing of St. Mike's Hospital, and actually prior to the closing of St. Mike's Hospital, we saw the need to address health concerns. And our partners, and we want to be ever so grateful to the sisters, the Franciscan sisters, and we want to be appreciative to those that labored and worked with us in that setting. And unfortunately, because of budget cuts at St. Mike's and other kinds of fiduciary matter, financial matters, they had to tear down their hospital and close clinic. But we were able to utilize volunteers, our parish nurse, Aurora Health, and others that came on board to provide and continue to assist. With the COVID situation, it just brought a whole closing to a number of things in our community and in our environment. But it did not stop the initiative or the plan. The plan continues now in a health perspective, and we are so overjoyed to see many of our civic leaders, community leaders, you, our parents, and religious leaders, and corporate leaders that have come today to say that healthcare and education is very vital and very important. Your presence is an indication of your commitment, and that we are very, very grateful and extremely thankful for your participation. Once again, the excellence of what we're doing now involves one of our community's finest partners in health, in providing health care, and that is Anthem Blue Cross. They have done an exceptional job in organizing and teamwork, partnership, collaboration, that we, in a very real way, are able to advance the things that make our community better. My doctor is here. I'm overjoyed to see Dr. Tobin sitting right there, and he has taken good care of me, and of course, he and the Lord are doing a good job. And so I'm grateful for him. I want to say to you that Tanisha Johnson has been instrumental, and she's going to present the entire team, but I want you to first give a thunderous applause to Tanisha as I present her now. And she's going to share with you the team that's coming and give you some information. I am so excited. And I want you to know that my excitement today is because now you can have preventative care. You don't have to wait until you're in a crisis situation, as many of us have been, to find that there's remedy and there's resolution and proper maintenance. So the clinic is designed, and the thing that we said, so I want you to know, community, I want you to know one of the ground rules of this partnership is that we would not turn away anyone. So no matter what is going on in your life, there is no reason for you not to have care. Little insurance, much insurance, no insurance, you have a safe haven here at C.H. Mason Clinic and the Holy Redeemer Consortium and community. May the Lord's blessings be with you today, and may his favor shine upon you. And please receive Tanisha as she comes. Let me just say this to you as I move away. Looking at me now, some of you all haven't seen me since last year and all the rest of it, and you had to look and see who is that handsome man that is standing there. So I am 100 pounds lighter than what I was last year, and so I am grateful and I'm thankful for that. Tanisha.
Hello, my name is Tanisha Collins Johnson, and I am the project manager for the C.H. Mason Health Clinic. I have the privilege of working with the community and faith-based organizations. I was so excited when I was asked by Bishop Daniels to help relaunch the health clinic in our community after he saw the increase of health disparities that affect our children and families. Growing up in Milwaukee, I noticed there were so many people who gave of themselves and yet lacked basic access to health care. The C.H. Mason Clinic will serve as a critical need for community members to seek health and wellness opportunities within a 12-mile radius. The C.H. Mason Clinic will provide a comfortable, neutral, safe haven environment where individuals being transparent about the issues occurring in their lives. The clinic will have trained professional clinicians and staff on site who will meet community members face-to-face to help support and assist them in guiding their access to appropriate determined services. Additionally, through collection of data, we will be able to better understand healthcare screenings, housing, transportation, food insecurity, social connection, faith, and other health factors can impact overall health and wellness of our community members. In phase 1, the clinic will provide blood pressure screenings, cholesterol screenings, BMI, weight checks, HIV and STI checks, diabetes, vaccinations, community events, and community resources through navigation. We will also have community navigators through our CHW program. We are dedicated and committed to providing service to transform a community, one service at a time. I am reminded of a famous quote by Dr. Martin Luther King. Faith is taking the whole step, even when you cannot see the whole staircase. I would like to introduce to you the planned president of Anthem Blue Cross Blue Shield of Wisconsin, Ted Ostholelder. Thank you.
With the opening of this clinic today, we continue our dedication to the communities we serve and our commitment to improving the health of humanity. We are proud to stand with Bishop Daniels' team today at the celebration of the relaunch of the C.H. Mason Clinic and look forward to working with all of you to connect folks to the care, support, and resources they need to lead healthy lives. Better healthcare starts with improved access right here. Thank you.
Good morning, everyone. My name is Antione Reasby, and I have the honor to serve as the Public Relations Director here at Holy Redeemer Church. I just want to take this time to thank God for Bishop Daniels for even having the vision to have a health clinic right here in our community. Can we give it up for Bishop Daniels? Thank you, Bishop. We are so honored to have so many of our community leaders here with us this morning, and we thank God for them. We're going to hear from our county executive, our executive David Crowley, from Senator Taylor's office, her chief of staff, my friend Michelle Bryant, and then we'll hear from our mayor, the distinguished Cavalier Johnson. Thank you so much.
All right. Thank you. Good morning, everybody. Good morning. Y'all doing all right? Because I can tell you, I'm excited. Now, I grew up in an old school Baptist church, so I got to first start off by saying I want to give an honor to God, who's the head of my life, my bishop, Marcus Arrington, and the bishop of this beautiful church, Bishop Daniels, and to all of my brothers and sisters in Christ. I have to say thank you to both Bishop Daniels, the Holy Redeemer family, as well as the Anthem Blue Cross Blue Shield. This is a great partnership. For those who may not know, at the county, we have revamped our vision, and that is by achieving racial equity, we can become the healthiest county in the state of Wisconsin. And the reason why we're focusing on health disparities is because they're rooted a lot in racism. And so when you think about what is happening right here on this corner, it's about providing people who live in or around the Holy Redeemer community to have access to health care. And some people may not feel safe going to some of the bigger healthcare systems that we have throughout this community. But it's important that people go where it is safe. And when you think about what they have been doing on this campus, it reminds me of the verse, James 2, verse 14. Faith without works is dead. And they have been putting in the work every day, not just around healthcare, but around education and bringing people from all walks of our community to the table to figure out how we move forward. So I just want to say thank you so much for this opportunity to join you all. And I can't wait to see what these doors do for so many people throughout this community. I appreciate you all, and God bless.
Thank you, sir. Excellent job. Excellent job. Good morning.
Good morning, everyone. It's a hard act to follow. My name is Michelle Bryant. I am Chief of Staff for Wisconsin State Senator Lena Taylor. Senator Taylor couldn't be here this morning. She's actually at a conference in North Carolina. And for the sake of time, I won't read the citation that she sent on her behalf, but I will say this. I just returned from New York. I got in this morning at 3:30 a.m. And I was at a funeral for my aunt. And she is someone who had had a number of healthcare challenges, did not trust the healthcare system, and actually chose to stay at home rather than getting the critical services that she needed because she was worried about cultural competency in the way those services were being delivered. It was so important for me, no matter how tired I was this morning, to get up and be here.
Wow,
and when I think about, yes, sir. And when I think about, DC, David Crowley, I'm sorry, that's the only way I know my brother, the county executive, he talked about growing up in the church. I also grew up in the church and the civil rights movement. And that song, ain't gonna let nobody turn me round, turn me round. Turn me round, ain't gonna let nobody turn me round. I'm gonna keep on walking, keep on marching, walking on the freedom land. The C.H. Mason Clinic, which was founded in 2008, while they had a setback and had to close their doors temporarily, they didn't let nobody turn them around. They understood that we need people to stand in the gap in our community, that we have marginalized, underserved, when other hospitals and other health clinics are making the decision to go to greener pastures, out in the suburbs, don't want to serve people that don't always have insurance, underinsured. We need people that are committed to stay here. C.H. Mason Clinic made the decision to be committed to stay here. So, when I think about my aunt, who was afraid to go to the doctor, who did not trust, who could have been able to go within walking distance to her home, to be able to receive services from folks that look like her in a community that was of her, I hope that everyone understands the importance and the significance of what's being done here today. If Senator Taylor was here, she would say that Bishop Cedric Daniels, the Holy Redeemer Church, has always stood in the gap. Whether we talk about education, whether we talk about faith and our spiritual relationship with God, they've always stood in the gap. This time, let's make sure that we stand with them. Thank you.
Wow. Thank you. Mr. Mayor.
Well, good morning, everybody.
Good morning.
I'm Cavalier Johnson, Mayor of the City of Milwaukee, and it's such a privilege, it's such a pleasure to be here to join all of you today as we relaunch the C.H. Mason Health Center. I know that Bishop Daniels has had a pretty busy week here because you got the 103rd convocation going on, right?
Yes, sir.
You got C.H. Mason that's relaunching, and I heard, little birdie told me that Bishop also celebrated a birthday recently. Is that right?
That's right,
Happy
I
birthday,
did.
Bishop. Well, look, I often talk about the power of partnerships and the power of working together in order to solve the most challenging issues that face us as a community. And as you can see from the folks who have taken this podium today, that's exactly what we have here. We have partners coming together to tackle a very important issue, and that's in terms of health care for the people who live here in our community. You just heard from Michelle Bryant, representing Senator Taylor's office at the state. You heard from Milwaukee County Executive David Crowley. You heard from Anthem Blue Cross. You heard from Bishop Daniels, and now you're hearing from me. So at all levels, inside of government and outside of government, people are taking this seriously and working to make sure that resources are provided for folks right here in our neighborhoods who need assistance the most. So on behalf of the entire city of Milwaukee, I couldn't be more privileged and more honored to welcome C.H. Mason back to our community, because it's going to provide resources that people in Milwaukee need, especially as it relates to their health care. So congratulations, Bishop. Congratulations, Anthem. Congratulations to all the parents, all the families out there that are going to be able to benefit from having these resources closer to home as they should be. So thank you very much.